So, welcome back to episode 3. This time around, we're going to talk about antiviral medication and specifically in relation to COVID. So, Dr. Krishan, can you tell me what an antiviral is and how is it relevant to COVID-19?
Hi Dixie, great to be with you again, and thanks for the good question. So we all know that COVID is a viral illness that can affect the whole body, and an antiviral is really, I think we've all taken antibiotics when we have an infection caused by a bacteria. An antiviral is like an antibiotic, but it's for an infection that's caused by a virus. So we know that COVID-19 is caused by the coronavirus. It starts in the throat. Can spread down to the lungs, and then it can get into the blood and impact all of our body. So antiviral medications really combat that infection in the body, and they've actually been around for a long time. They've been used to treat, other nasty bugs and other viruses like, hepatitis, influenza, and now COVID. So how it works is we know that when a bug, a virus in this case, that causes COVID enters the body, the human body becomes a host, a really nice place for that virus to multiply and grow rapidly within the body. And so the number of virus particles in your body, they double and they double again and they double again really quickly. And that's what causes us to feel sick. And so it sets off our body's immune system to fight it. And this can cause a fever as well. And that's how you know that your body's immune system is hard at work. But often your body's immune system, even if it has been trained, if you have been vaccinated in the past, it's not enough. And so that's how an antiviral works. So it works by, it's like putting sand on a fire. So it slows down the fire, and eventually it helps the body put out the fire altogether, so to speak. So an antiviral is a tablet, so it's something that you take at home, just like an antibiotic, for a number of days, and it prevents you from getting a severe COVID disease. But that's really one of the important things. It needs to be taken at home, and you need to take it early, within the first 5 days of symptoms. And the reason that is important is that's because the phase or the time when the virus is multiplying rapidly.
Right. So, how do you access a antiviral? Where do I go to? What conversation do I need to have? Like, what's the process from me being crook to having a positive test with my rat to then getting an
Okay.
antiviral?
So the first and most important thing is if you do have symptoms that might be COVID, and I think we all know what those symptoms are. Usually, upper respiratory symptoms. It may be a headache. It may be a fatigue. Maybe some breathing problems. It may be a cough. Is to test with a rat as quickly as possible, and if you test positive, to contact your health service, by over the telephone or via telehealth, and say, you've just tested positive. Am I eligible for an antiviral medication? And how do I get one? And so it's a prescription medication that you can get from any pharmacy. But it's really important that you have that conversation with your medical service, with a GP, with a health worker, as quickly as possible after you test positive, so you can have a chat, have a yarn, and discuss whether an antiviral treatment may be appropriate for you.
Okay, so do you have to can can you have an antiviral already at home, or is it something that you need to consistently, if you're testing positive to it, you've got to go to the doctor and get it, or can you just stockpile it?
Yeah, no, at this time in Australia, you can't have an antiviral ready and waiting at home for eligible people. So you can only get a prescription for it. You can only get a pack once you've tested positive and your health worker, your GP, has written a script for it. But what you can do to be proactive about your health is to actually speak to your health worker uh, beforehand, to say that, look, if I do happen, I'm vaccinated, I'm up to date with my booster doses, but if I do happen to get to get COVID, to test positive, would I hypothetically be eligible for an antiviral, and would it be appropriate for me? So you can have that discussion in advance, and I suppose come to a decision that with your healthcare worker that yes, it's right for me, or no, it's not appropriate for me. And so if the answer is yes, if you do test positive, you'll save a bit of time because you've already had that discussion. So it means you may be able to access the antiviral treatment more quickly.
Okay. So, what are some of the dangers, or are there any dangers to taking an antiviral?
So, like all medicines, antivirals like antibiotics can cause some side effects. The most common side effects are, well, it depends on what antiviral you're taking, but it can cause a bit of tummy upset, or some people are reporting a bit of a funny taste in their mouth while they're taking the tablet, and that has been seen with other antibiotics and antivirals as well. But the important thing is to have a chat with your health worker to see whether there's any other reason that you shouldn't take an antiviral. And so it's important that you go to a GP or a doctor that knows all about your health, knows what other medications you're taking, so they can make a recommendation to you and you can come to a joint decision as to whether an antiviral may be suitable for you. And they also know what the eligibility criteria as well. So they're only supported by the government or funded by the government for certain groups of people, and that includes many people, many Aboriginal people as well, especially if they have other chronic health conditions as well.
Okay, so we do know that there are people that have access to the antiviral medication. We now know there's a process around what it is that you do, which if you test positive with your rat or with, I don't know what the other test is called, to be honest, but if you test
So a
positive, then
PCR
you could,
test, yeah.
yeah,
But most
sure.
people are doing
Um,
rats these days because they're much
so
easier.
what is that called again?
So the initial test was what's called a PCR test.
The very aggressive one that was like touching my brain, that one that
Yeah, look,
traumatized the
I,
entire
I
country.
I felt like that as well when I had a PCR test.
Triggered.
Yeah, it's going so far, and I'm going, hang on, how far up is that going? But no, it was a very safe test.
Okay, great, because I don't ever want to go back to that test again because it was aggressive and it was unpleasant.
It was.
It was a mess. So we know if we test positive, we go have a conversation with our doctor, our healthcare worker, make an appointment, and then we can get a prescription for the antiviral medication. And is it true the earlier you take it, the more effective it can be in terms of minimizing the symptoms?
Yeah. So you want to take it when the virus is multiplying at its fastest, and so that's definitely within the first 5 days. But so early on within that 5 days as possible, the better. I think the only thing I'd add is remind your listeners, if you're in a vulnerable group, and many Aboriginal Australians are, to make a proactive plan. So don't wait till you test positive. Speak to your health service in advance. If I test positive, what should I do?
Okay, cool. Well, thank you very much for all of that information. I now know that we've got vaccines, we've got boosters, and we've got antivirals, all really because this COVID, this SARS virus is consistently changing, right? And it's important that we prepare our bodies because from memory, when you were just talking before, well, actually, I'm about to say that word again, but the boosters and the vaccines are about preparing your body for when you might, from a memory point of view, for when you might get the illness, right? Is that correct?
Correct, yes. So they're really, that's priming your body's immune system so that if you get an infection, you can fight it off as quickly and effectively as possible.
Yeah. Okay, cool. Well, thank you very much for that. I appreciate your time today. And yeah, let's keep learning more together with Dr. Krishan.
Thanks, Dixie. Looking forward to our next chat.